I'm pleased to introduce our opening keynote speaker, Steve Forbes, Editor-in-Chief of Forbes Media. Please join me in welcoming Steve Forbes.
Good morning. Thank you very much, Megan, and thank all of you for coming out on a Monday morning to get what is my version of global warming, some hot air from up here. But it is a great pleasure to be here. Obviously, you're in the center of the biggest domestic issue in America today, and it's going to be an issue in the 2016 elections and probably thereafter. But what I'd like to do this morning, before we get to the panel, is to make some observations about why we have a health care crisis, which will sound simplistic, but sometimes simple can be enlightening. And that is to ask the question, why do we have a health care crisis? Why is it something that is dominating domestic politics the way it is today? And it's certainly not the quality of overall of health care in this country, even though there are problems out there. You compare our care with just about overall with any other country or continent in the world, and we are by far number one. Longevity, when you take out homicides and automobile accidents and the like, is the best in the world. So what is the problem? In most people's minds, the problem is that people like me are getting older, and we want more health care services. So demand keeps going up, therefore prices go up, therefore availability becomes a real problem, and we have the kind of mess that we have today. But step back for a minute and ask yourselves a question. Why is demand for health care considered a crisis, whereas demand for anything else in this economy is considered a great opportunity? If you want more apps, a lot of writers will be glad to help you out. You want more hotels, Marriott and others will be glad to help you out. More cars, Detroit and other manufacturers, glad to come to your assistance. If people see an opportunity demand, you get entrepreneurs pouring in, figuring out how to meet it, or come up with things that you never even thought of before. You know the famous phrase of Steve Jobs, when he is asked, the late Steve Jobs is asked, does he do marketing surveys? He said no, because people don't know what they want until we show them. So we have a lot of entrepreneurship, obviously, in the whole area, but the real thing is we don't have enough. And so the question then becomes why? Why is demand here considered a problem, demand everywhere else a huge positive opportunity, growth industry? The answer, of course, is in this space we don't have real free markets. We have pieces of it, which is why we still produce more new medical devices and new drugs than the rest of the world, but we don't have real free markets. And just think of it. We've grown up with this system, so we don't realize how, in some cases, weird it is. You go to a clinic or hospital, and you ask in advance what it's going to cost. You get a very strange look. It means one of two things. Either you're uninsured or you're a lunatic. Why would you want to know the price, assuming the provider even knows the real price? Well, some of you may tonight go out to dinner. Imagine going to a restaurant, ordering a fine bottle of wine, great meal, and saying, I don't care what it costs, let Medicare, Aetna, somebody else figure it out. So the system goes kind of haywire. And so we get the kind of weird hybrid system we have today. No one designed it. As you all know, it came out of price controls from World War II. So we have this employer-provided system, hybrid with government-provided. So previous to the Affordable Care Act, Obamacare, we had an unsustainable trajectory. Even though rises would go up and down, the fact of the matter is the overall trend is cost was going up faster than incomes. Now, the Obamacare, the Affordable Care Act, that is manifestly not the answer. It's made the situation worse and, in effect, doubled down on the old unworkable system. It has become immensely complicated, worse than the income tax code, which is saying something, almost worse, but you're getting there. Immensely complicated. For example, subsidies, trying to guess your income for the coming year. A lot of people may have nasty surprises this year. from what they thought they were going to earn, trying to project your income in the future. Also leads to a form of a welfare trap. As your incomes go up, your effective marginal income tax rate with the subsidy system they have goes up even more than the stated rate, which is a dampener on the economy. Mandates, new federal mandates, piled on top of state mandates. Now, some states have been careful on mandates. Others have been absolutely idiotic. I live in one of them. New Jersey has one of the worst regulatory systems in the country. I can go to neighboring Pennsylvania and get a perfectly good insurance policy at about half the price in New Jersey, but it's illegal. I'll discuss that in a moment. So then the overall situation is becoming intolerable as they issue exemptions. More and more people complain how the system works or doesn't work. And so you've already gotten a reaction. The thing is more unpopular today than it was passed back in 2010. The reaction to the individual mandate, adverse. Employer mandates have distorted the labor markets. So it's more unpopular than ever before because the system has wrong incentives. It was bad enough under the old regime. The system was not designed but evolved in a way where insurers have an incentive to more and more give you narrow choices, more and more narrow the networks, keep you away from the best and the most expensive facilities. Customer service. This is an anecdote, but I don't think it's true of the overall situation. Professional woman in New York needs some treatments. Customer service, terrible. Well, when you use the system, the insurers, in effect, know they have a problem. Use means a problem. And just compare ads for, say, homeowners insurance or auto insurance with health insurance. You've seen those ads where the tree falls on the car, or Allstate, you're in good hands. Compare the health insurance ads. Young people, not old people in trouble, will help you out. They want young, healthy people. Contrast those two kind of ads. People on our website have done it. So the system is skewed, not to the consumer, but to trying to save costs in a top-down way. And so we have a situation where if Obamacare did survive, we'd have less flexibility than we did before. So the entrepreneurs won't have the opening to make the changes they need to make. So what the Affordable Care Act has done, what Obamacare has done, inadvertently, they didn't mean this to happen, is they're creating an opportunity, it's created an opportunity to move the system to more genuine patient control. We're not there yet, we're far away from it, but it's the only way we're going to save health care in America. Part of what ACA is doing is getting employers more and more out of the business of supplying health insurance. Already, they're moving in that direction with higher co-pays, higher deductibles, and the like. But these measures so far haven't really reduced the real cost of health care. But there are signs already that the system is beginning to profoundly change. Right now, it's messy. All we see are the problems and trying to cope with more and more rules and regulations. But there are signs out there of what's going to come. Take a little one. Sounds silly. Flu shots. Once upon a time, if you wanted a flu shot, you made an appointment with a doctor or a clinic, went there, got the shot. Today, talking about health delivery, you go anywhere and you get a flu shot. Drugstores, airports, go to the gas station, say, fill her up, give me a flu shot, do the windshield. It's everywhere. You see it, too, in the rise of walk-in clinics, CVS, Walgreens, and others. If regulators allowed it, more and more of Walmarts and Targets of the world would plunge right into it. Concierge medicine. You see it in the rise of medical tourism. Over 1 million Americans do it. Websites providing more and more information. I'll just touch on that in a moment. No insurance. You go to certain physicians. You go there, get a discount, and they don't even bother with insurance. Or you go to certain other doctors, they'll give you a form, and that's it. You pay the fee. You want to get reimbursement, you undertake it. They're not going to bother with it, not going to have the administrative costs with it. Prices go down. You see it, too, in terms of LASIK surgery for the eyes. because you don't have the disconnect between providers and consumers. That procedure today costs less than it did in real terms 10 or 12 years ago. Our publisher, Rich Karlgaard, told me the other day, he said years ago he had it done, $5,000. He said today he could probably get it done for $2,500 or $100 or $3,000 and probably get a better result. Why? You don't have the disconnect between providers and consumers. See, the same thing in cosmetic surgery. None of you here need it. Yeah, that's called pandering. Tried it in politics, didn't work, which is why I'm here today. But in the last 18 years, use of cosmetic surgery, all kinds, has gone up sixfold in this country. Huge technological advances, but you haven't had the kind of inflation there that you've had in the rest of health care. Why? Because unless it's a result of disease or accident, you don't have the disconnect between provider and consumer. So let's say you want a procedure done. You scope it out like you do anything else. If you have friends who can keep their mouths shut, you might ask them for advice. And so the system works better than the rest of the healthcare system in terms of breakthroughs and in terms of prices that are affordable because you're writing the check. You see it, too, in the massive rise, which will be part of the new healthcare systems that evolve, medical savings accounts. Companies are already doing it now. There's no reason why you shouldn't have a medical savings account for non-catastrophic expenses. But it's essential to have patient power. Now, you say that and you think, oh my God, the political season is upon us. Even here, they're going to talk about patient power. But the system needs the patient in control. Because even though when you get improvements in medical outcomes still don't lead to better economic outcomes. In the rest of the economy, you make a breakthrough, it has an enormous impact, both on supply and price. You see it, for example, let's make this point. Mention free markets. Free markets always, if you let them, if you have them and let them, will always turn scarcity into abundance. Take, for example, the automobile. 110 years ago, cost the equivalent today of $125,000. It was a toy for the rich. And along comes Henry Ford and his engineers, perfect the moving assembly line and turn a toy for the rich into something every working person can afford. Another example, cell phones, what we now call handhelds, mobile devices. You look at the first cell phone 30 years ago, it was just voice, big as a shoebox, weighed as much as a brick, 40-minute battery life. First one out of Motorola, $3,995. Today, many of them are just giveaways, depending on the plan you have. And it's evolved far, far from just mere voice. Now we're going to get smartphones being developed for $25 to $35, which is going to have an enormous impact, especially in developing countries. Whole world in your hands, $25 to $35 a pop. Does everything now, except maybe comb the hair or grow hair. Maybe the next iPad Pad 7 will do that. Who knows? But it's amazing. But I guarantee if we had in that whole space the same kind of system that we have in health care, that device today would still be as big as a shoebox, maybe a little smaller, would cost $9,995, and we'd have federal programs to make it more available and affordable and subsidies and everything else. Think about it. So in short, are the American people in a mood for more markets, real markets in health care, even though we've never really had them? Well, think of it. Americans can get more affordable health care and insurance if you have just the way we have with computers, cell phones, flat-screen TVs, and the like. People today are more keenly aware of the virtues of open markets thanks to the tech boom of the last 30 years. People may not have read Milton Friedman or Adam Smith or Friedrich Hayek, but they've learned about the importance of open competition and choice in bringing about innovations and lowering prices. They've seen it in their own lives every day because they've lived it. So this will become more and more of a reality in medical care. The tools there are being developed for it. You're all familiar with Castlight, another company ran into last night, a fellow named Michael Cadger, I think he's here this morning, of Monocle, huge data to be able to start to make informed choices. Now, the timing of it is uncertain. As you all know, we have a big court case, Supreme Court case out there, King versus Burwell. Anthony Scalia has tried to give his fellow justices a way to do this without trying to minimize the disruption by saying that, gee, if we throw this thing out, maybe we can say it remains in place for a year or to the end of the year, some transition period to take care of people who suddenly might lose their subsidies. But I don't think that'll happen. My own feeling is that the Chief Justice will once again cave into pernicious pressures and rescue Obamacare once more. But that will only be a reprieve. The unpopularity and the political pressures of the 2016 election season, which is now just beginning to get underway, will spell the end of the essence of Obamacare. Whether it's formally repealed or just chunks of it are chopped away, a new system is going, I think, to emerge. And what you're going to see is the employer mandate's going to go, the individual mandate's going to go, and the mandate on the federal level on what insurance should have will go out the window. What you're also going to see after the 2016 elections is a serious push in Congress, something the Republicans have been pushing for years, beginning to attract more and more support, and that is to have nationwide shopping for health insurance. We sort of have it with the exchanges, but to be blunt about it, the only difference between most of those plans is the price you pay. There's not real competition. But what you're going to see is what I mentioned earlier. I live in New Jersey. I can buy a car in Pennsylvania, a house in Pennsylvania. In a couple of years, I'll be able to buy insurance in Pennsylvania as well. So what that means is states like New Jersey and New York that have crazy mandates are not going to imprison their residents with a crazy system. You can buy it from any state in the union, buy any policy anywhere around the country. So you're going to get genuine choice, not the phony choice that we have today. I think you're going to see it push too, even though it's just beginning today, in terms of subsidies, not based on income, which just makes it hideously complex, but based really on age, regardless of income. Makes it immensely easier. Certain age, certain subsidy, done with it. You're going to see a push for real tax credits and vouchers available to everyone. I like the voucher idea better than tax credits because I think the tax code is cluttered enough as it is. But numbers, John Goodman has thrown out the number of $2,500 for an individual, $8,000 for a family. And so what this is going to bring about is this kind of universality is it's going to put a real push for genuine insurance in health care. We don't have real insurance, and being very blunt, since I'm not running for anything, very, very blunt, we don't have real insurance in health care even today. It's simply trying to figure out, guess, what next year's expenses are, how much you can squeeze out of the employees, and then charge up for administration and for profit. That is not insurance. If you step back, it is crazy. Imagine dollar-for-dollar coverage with everything else. Skews the whole system. And so what you're going to see is real catastrophic coverage, because one of the features that's going to be coming, I think, in the next 2 to 3 years is on those vouchers or tax credits, what you don't use, you get to keep as your own personal property in a medical savings account. So, as they say, you're going to have more skin in the game than ever before. So what you're also going to see is that another reform is that an event is going to be covered by the insurer when it happens to whatever result comes about. In other words, right now, if you have homeowners insurance and your house has a fire, that insurer is obliged to cover you and pay what they promised until the home is rebuilt. Auto accident, you're covered for that event. Whereas we know with the current system, if I have one policy with one employer, I get sick, either the employer drops the insurance or I get another job, that insurer is not covered for that event anymore. That's not real insurance. You're also going to see a push for equal tax treatment. As you know today, employers, self-insured, get a deduction. Rest of us don't, which skews the market. Obamacare has already made the individual market very, very anti-individual. Tax code makes it even worse. So you're going to see a push for that. And in terms of employers being in the business, which grew, as I mentioned, out of World War II, you're going to see the flat tax, single rate system is going to become a major issue in the 2016 campaign. Now, obviously, I've been pushing that for years, but I know of at least 5 potential candidates who are going to make a variation of the flat tax part of their platform. So it's going to be a real issue. And even if we don't get what I would like, you're going to get radical tax simplification. And one of the things that's going to be in the eyes is going to be the employer deduction. In other words, give it to the employee, not to the employer. The exchanges, they'll in effect be privatized. New ones will rise up. We already see it online. We see it with hotel and travel, but like TripAdvance and Priceline. But you're also going to see it more and more online. Instead of government trying to create exchanges, private sector will do it very nicely. Thank you very much. Medicaid is going to be booted to the states in a block grant, just as the Welfare Act did in 1996. The adjustments are going to have to be made because some states have expanded their Medicare, some haven't, after the passage of the Affordable Care Act. So that'll be a political fight, but in essence, states are going to be block granted. And you're going to see more and more experiments to how to make that safety net work. Rhode Island, as you know, has been a pioneer. It got a waiver for fixed cap through managed care, competitive bidding with private health care providers and the like, getting people out of nursing homes into home care and community-based care. They've had some initially great success. Utah is trying an experiment. Kansas and others will be trying to experiment, trying to find ways to make this system better. So ultimately, I think what you're going to see on Medicaid is what I mentioned is going to happen in the aftermath of the ACA, and that is vouchers. Let people work in the marketplace. That is the way you get innovation. So, and in terms of Medicare itself, Medicaid will go to the states. Medicare itself, you're going to see among the next 5 years, among young people, a new system where, in effect, they're going to be putting money aside, taken out of their checks, their pay, putting aside in a long-term medical savings account. So when they reach age 65 or 67 or whenever, they'll have the wherewithal there to get better insurance and better coverage than they do today. So as you know, big breakthroughs are coming. You see it in terms of devices. A few months ago, I played with one where you put your fingers under this thing, watch the squiggly lines go up and down. EKG done. I'm old enough to remember all those suction cups they used to put on you. You're getting huge breakthroughs in terms of cures, especially in cancer. There are in areas there, using the immune system. Very, very real breakthroughs. So the bottom line on all of this is we're going to have a system, government will be involved, but it's going to be more and more like what we have with food. Government's involved in agriculture, but government does not run agriculture. If government ran agriculture, we'd have no more obesity. We'd all be starving. They tried that in Russia and China. It didn't work out so well. But so we have agriculture-produced food. Private companies process the food. Truckers and others deliver the food. Everything from supermarkets, hotels, and the like sell the food. And people have problems. We have everything from food stamps to food banks to deal with it. So bottom line, messy transition. Just don't get sick for the next 3 years until we sort this thing out. But the bottom line is, what we're going through now is going to turn health care from a seemingly hopeless liability, complex liability, into the greatest growth industry ever, because health care is personal. Thank you very much.